Yeah, it's been really nice as a public health student. I always say that I'm getting my degree in COVID, not public health, because that's sometimes what it feels like. But as far as my professors, my peers, most of them are like working on the front lines or behind the front lines in COVID response. So they have been super great to just be able to reach out to, email with questions and all of that. My name is Tabitha Edson. My pronouns are she, her. I'm a senior public health student. I feel like my life has changed a lot over the past year. I left some of my campus jobs in order to be able to work full time. But I've had a lot of fun being able to gain valuable experience with the health department, increase equity within our COVID response. And so it's been hard, but I've been going to school online, which has been very flexible. And also just doing my cases in between classes, working at the vaccine clinics on days where my classes are a little more slow. But other than that, it's been pretty good. Actually, in January, I started to work for Salt Lake County Health Department as a contact tracer. And as our COVID cases have started to go down, I've been working with the vaccine clinic. Now that COVID's kind of on the rise again, I've gone back to full-time contact tracing, but I've had a really good time being able to work at the vaccine clinics. I've been working at some of our outreach vaccination locations, so we will partner with a specified organization. After this interview, I'm actually going to the Tongan Methodist Church for one of our small vaccine pop-up clinics. And that works in a lot of ways just to address mistrust between those communities, medical professionals, vaccination hesitancy, all of that. And hopefully just one more step to getting more people in the community vaccinated. I think Westminster has done a great job in terms of mobilizing student health services into testing, but I do not think that the vaccines will be offered here just because of how hard they are to get, how hard they are to store, but they have made vaccination efforts available to students. My best piece of advice is just to remember that vaccination is a community effort just as much as it is an individual effort. It's really promising when an individual gets vaccinated that they are protected from a likelihood of having severe COVID, but the more folks that we can get in the community vaccinated, the sooner we'll be able to open things up, but we shouldn't rush. So one thing is if you are not vaccinated yet, you can go, there's several websites to get your vaccine. You can go on vaccinefinder.org, Know Me Health, check vaccinate.utah.gov. Those are great resources. Sign up, get your appointment. Like I said, vaccination is a community effort, and as the Westminster community, I think we all need to come together and get our shots.